Dr. Sarah Chen had been a therapist for 12 years, and she'd never experienced anything like this. It started with Marcus, a new patient suffering from severe childhood trauma. During their third session, as Marcus recounted his memories of being locked in a basement for days without food, Sarah felt something strange. A sharp pain behind her eyes, followed by a flood of sensory details she shouldn't have known. The smell of mildew, the texture of concrete against small hands, the particular way afternoon light filtered through a window well, striping the darkness. "Are you all right, Dr. Chen?" Marcus had asked, noticing her distress. "Yes, I'm fine," she'd lied, pressing her fingers to her temples. "Please continue." But she wasn't fine. That night she woke up screaming, convinced she was trapped in that basement. It took her husband 20 minutes to calm her down, to convince her that she was in their bedroom, not buried alive in someone else's nightmare. She told herself it was just empathy, that she'd been working too hard, that she needed a vacation. Then came Jennifer. Jennifer's trauma was different, a car accident that had killed her sister. As Jennifer described the moment of impact, the screech of metal, the spray of glass, Sarah felt it again, that same stabbing pain. And suddenly she was there, in the passenger seat, watching the truck's headlights grow impossibly large, feeling the moment when everything went wrong. She had to excuse herself from the session. In the bathroom she vomited, her hands shaking as she gripped the porcelain. This wasn't empathy, this was something else. Over the next month it got worse. Each patient's trauma began to embed itself in her mind like a parasite. She experienced Robert's mugging in vivid flashbacks. She woke up tasting smoke from Amanda's house fire. She felt the phantom pain of David's childhood abuse. Her own memories began to blur at the edges, crowding out with other people's pain. "You need to see someone," her husband Tom said, watching her wake up screaming for the 5th night in a row. "This isn't normal, Sarah. You're absorbing their trauma somehow." "That's not possible," she insisted, but her voice wavered. She started researching. Late nights in her office, diving into obscure psychology journals, medical anomalies, anything that might explain what was happening to her. She found nothing. No documented cases of literal memory transference. No scientific explanation for why she was drowning in other people's pasts. Then she noticed the pattern. Every patient whose trauma she'd absorbed had been referred to her by Dr. Elizabeth Vance, a psychiatrist who'd recently retired. Sarah had inherited most of Elizabeth's patient list when the woman moved to Arizona for her health. Sarah called Elizabeth's office. Disconnected. She tried Elizabeth's personal number. It rang and rang, then went to a voicemail box that was full. Something cold settled in Sarah's stomach. She started digging deeper, looking into Elizabeth's background, her career, her patients. What she found made her blood run cold. Elizabeth Vance had been practicing for 43 years. She'd had hundreds of patients, and according to medical records, Sarah definitely shouldn't have been able to access but did anyway in her desperation. Elizabeth had been diagnosed with early onset dementia 15 years ago. 15 years ago, and yet she'd continued practicing until 6 months ago. Sarah's hands trembled as she pulled up more records. Elizabeth's condition should have deteriorated rapidly. She should have lost her medical license. She should have been incapable of practicing therapy. But instead, she'd continued for 15 more years, sharp as ever, right up until her sudden retirement. That's when Sarah found the video. It was buried in an old backup of Elizabeth's patient database, a recording that should have been deleted, marked with a date from 8 years ago. Sarah almost didn't watch it. Almost. The footage showed Elizabeth's office, but from an odd angle, as if filmed secretly. Elizabeth sat across from a young woman Sarah didn't recognize. "Close your eyes," Elizabeth was saying, her voice warm and soothing. "Just relax. Let me help carry this burden for you." The session looked normal enough, standard guided meditation, nothing unusual. But then Sarah noticed Elizabeth's expression. The moment the patient began recounting her trauma, Elizabeth's face changed, her eyes became sharp, focused, hungry, and when the session ended, Elizabeth looked younger somehow, refreshed. The patient, meanwhile, looked confused. I can't quite remember," she was saying. "It's fuzzy now, like it happened to someone else." Sarah's breath caught in her throat. She fast-forwarded through the video, watched Elizabeth check a small notebook, writing something down with a satisfied smile. The last thing on the recording, before it cut off, was Elizabeth looking directly at the hidden camera, at Sarah, through time, and smiling. That night, Sarah couldn't sleep. She lay in bed, Tom snoring beside her, and felt the weight of dozens of traumas pressing down on her mind. Marcus's basement, Jennifer's car crash, Robert's mugging. They were all there, vivid and real, and they were eating away at her own memories. She tried to remember her wedding day and found the memory fragmented, displaced by Amanda's house fire. She tried to remember her daughter's birth and found it buried under David's abuse. She was losing herself. The next morning, Sarah called in sick and drove to the address she'd found for Elizabeth Vance. It was a small house in a quiet suburb, the kind of place where retired people go to fade away peacefully. Elizabeth answered the door on the first knock as if she'd been expecting her. "Dr. Chen," she said warmly, "please come in." Elizabeth looked exactly as Sarah remembered from their single meeting 6 months ago, sharp-eyed, alert, healthy. Not at all like someone who should be in the late stages of dementia. "You look well," Sarah said, her voice hollow. "I am well," Elizabeth replied, leading her to a sitting room filled with photographs, hundreds of them, patients, Sarah realized, decades of patients, all smiling, all looking slightly dazed. "Thanks to them, thanks to you. What did you do to me?" Elizabeth settled into her chair with a sigh. "I saved myself, Sarah. 43 years of listening to trauma, of absorbing pain. It was killing me, destroying my mind. The dementia diagnosis was just the beginning. I could feel myself disappearing piece by piece. So you learned how to pass it on?" "Not just pass it on," Elizabeth corrected. "I learned how to transfer it. Their trauma, their memories. I took them into myself, absorbed them, and in doing so I kept my own mind strong. Fed it, you might say. The human brain is remarkably plastic, Dr. Chen. It can be trained to do extraordinary things." Sarah's hands clenched into fists. "And now you've done it to me, given me your patience, knowing I'd start absorbing their trauma just like you did." "Not just like me," Elizabeth said, and now there was something cruel in her smile. "You see, I needed to retire eventually. Needed to stop before someone noticed the pattern. But I couldn't just stop. The trauma I'd absorbed over the years, it needed somewhere to go. Someone to go to." The room seemed to tilt. "You gave them to me," Sarah whispered. "You transferred your entire collection, 43 years of trauma. That's why it's happening so fast, why I'm drowning in it." "You were the perfect candidate," Elizabeth said. "Young, empathetic, desperate to help. I knew you'd take on my patient list. I knew you'd see them all, try to help them all. And with each session, a little more of what I'd been carrying would transfer to you." Sarah felt sick. "The patients are free," Elizabeth finished. "Lighter, happier. I genuinely did help them, Sarah. I just didn't mention the cost or who would pay it." "There has to be a way to reverse it," Sarah said desperately. "A way to give it back, to stop this." Elizabeth's expression turned pitying. There is. The same way I survived for 15 years past when I should have lost my mind completely. You find someone else, someone young, eager, empathetic. You teach them, mentor them, and when the time is right, you pass your patients and their trauma along. I won't, Sarah said. I won't do that to someone else. Then you'll lose yourself completely, Elizabeth said simply. I give you 6 months, maybe a year, before your own memories are completely buried under everyone else's. You'll forget your name, your family, everything that makes you you, and you'll spend the rest of your life in a facility somewhere, living 100 different traumas on an endless loop. Sarah stood up, her whole body shaking. There has to be another way. If you find one, Elizabeth called after her as Sarah fled to the door, do let me know. I'm curious. The next 3 months were hell. Sarah tried everything. She stopped seeing patients, hoping the memories would fade. They didn't. She tried medication, meditation, hypnosis. Nothing worked. The traumas were embedded now, growing like tumors in her mind. She barely recognized Tom anymore. Sometimes she called him by other men's names, abusive fathers, neglectful husbands, attackers. Her daughter looked at her with fear and confusion when Sarah flinched away from her touch, lost in someone else's memory of pain. She was disappearing. And then, one night, as she lay in bed, unable to sleep, buried under a mountain of borrowed nightmares, an idea came to her. It was monstrous, unthinkable, but it might work. The next day, Sarah called Elizabeth. I need to know how you did it, she said, how you transferred the memories in the first place, the technique. Elizabeth's laugh was warm, welcoming. I knew you'd come around. Come to the house. I'll teach you everything. But Sarah didn't go to Elizabeth's house. Instead, she scheduled an appointment with Dr. James Morrison, a psychologist who'd been asking her for supervision sessions, eager to learn from a more experienced therapist. He was young, brilliant, and deeply empathetic. Perfect. No, she couldn't. She wouldn't. But as the days passed and she felt more of herself slipping away, as she forgot her mother's face and couldn't remember what her own voice used to sound like, the idea became less monstrous. It became survival. The day before her scheduled session with James, Sarah drove back to Elizabeth's house one last time. Elizabeth answered the door with that same knowing smile. Ready to learn? Actually, Sarah said, I have a different question. These memories you've been carrying, the ones you transferred to me, they came from your patients, real people with real trauma. Yes, Elizabeth said slowly, sensing something. But you absorbed them so long ago, decades for some of them. You've been carrying them around, feeding on them, keeping them alive in your mind. Sarah took a step closer. Which means they're still there, aren't they? Inside you. You never really got rid of them. You just learned to manage them, to use them. Elizabeth's smile faltered. What are you getting at? I'm saying you're full of trauma, Elizabeth. 43 years worth. And you taught me how to absorb it from patients during their sessions. Sarah pulled out a small recorder. I was thinking, what if I treated you? What if we had a nice long therapy session, just the two of us? Understanding dawned in Elizabeth's eyes, followed quickly by fear. You can't, she said, backing away. You don't know how to control it, how to manage. I don't need to control it, Sarah said, following her into the house. I just need to take it back. All of it. Everything you've been carrying, everything you dumped on me, I'm going to pull it right out of your mind and back into mine. It will destroy you, Elizabeth gasped. 43 years plus your own patience. No one can survive that much. Maybe, Sarah said. But here's the thing about trauma, Elizabeth. It wants to be heard. It wants to be witnessed. And you've been hoarding it, using it, keeping it locked away to feed yourself. She grabbed Elizabeth's wrist. So let's hear it. All of it. Every story, every scream, every nightmare. You're going to tell me everything, and I'm going to take it from you. Please, Elizabeth whispered. But Sarah could feel it already. The connection forming, the memories starting to flow, but this time in reverse. They talked for hours. By the end, Elizabeth Vance was an empty shell, curled up on her living room floor, her mind finally succumbing to the dementia that should have taken her years ago. She'd forgotten how to speak, forgotten her own name. And Sarah. Sarah drove home in a daze, her mind screaming with the weight of hundreds of traumas, decades of pain, all crashing through her consciousness at once. She made it to her driveway before she collapsed. Tom found her there an hour later, unresponsive, her eyes open but unseeing. The doctors called it a psychotic break, said she'd had some kind of complete mental collapse. They moved her to a long-term care facility where she could be monitored. Sarah Chen spent her days in a quiet room with soft walls, living through an endless cascade of other people's nightmares. Sometimes she screamed. Sometimes she wept. Sometimes she simply stared at nothing, lost in memories that weren't hers. But here's what the doctors didn't know, what Tom and her daughter didn't understand. Sarah was still in there, still fighting, and every day she was learning to organize the memories, learning to separate them, categorize them, control them. It was slow, agonizing work, like sorting through the wreckage of 1,000 lives. But she was doing it because she'd realized something in those final moments before her collapse, something Elizabeth never understood. The trauma didn't have to consume her. She could carry it, hold it, witness it, not by feeding on it like Elizabeth had, but by honoring it, by giving each memory the space it needed, the acknowledgement